Hello! Medicaid renewals are back on a yearly cycle in New York. If you are 18 or older and your Medicaid is handled by your county local Department of Social Services, or LDSS, this video shows exactly how to complete and submit your recertification packet on time so your coverage doesn't lapse. Not sure who handles your case? You can check the LDSS directly at health.nyc.gov/health_care/Medicaid/LDSS.htm. If you are enrolled in a CCO, a care coordination organization, do not hesitate to contact your care manager for assistance. They are prepared to be there for you through this whole process, assisting with paperwork, confirming who will submit, tracking the due date, verifying receipt by Medicaid, responding to any deferral requests, and ensuring an approval notice is issued. Even if you recently certified within the last 6 months, it is best practice to submit the packet and ask questions afterwards. If you're unsure whether you need to submit it, please do not wait for Medicaid to respond before turning it in, as delays can lead to case closures. Now, what's in your packet and why deadlines matter? Adults who renew through their local Department of Social Services are often in non-MAGI groups, like adults with disabilities, people with a spend down, or those seeking community long-term care. Your LDSS mails a renewal packet. Page 1 of your packet includes a notice with your case number and contact information for your local district. Your due date will be in bold and the return address. Keep the notice pages, especially the page with the return address, because local districts no longer include prepaid return envelopes. Authorized representatives and the DOH 5247. If you want help with forms and deadlines, adults can name an authorized representative using Form DOH 5247. The authorized representative can apply for or renew Medicaid, discuss the case, and receive notices. The form stays in effect until changed or discontinued, and it allows the authorized representative to access personal health information for Medicaid purposes. Now, before you get started on the packet, make sure you gather your necessary documentation. To avoid delays, include proof up front for everything you list on the renewal. Recent pay stubs from the past 2 months, Social Security benefit letters, unemployment statements, insurance cards front and back, and bank statements for reported accounts. So let's walk through how to fill out the packet. Section 1, Address and Contact. Confirm your home and mailing address and add reliable phone numbers. Medicaid relies on mail. Wrong addresses cause missed notices and closures. Section 2, People renewing. For adults 18 years of age or older, renewing with LDSS under non-MAGI rules, only the Medicaid member should be listed. Add a spouse or minor children you legally support if applicable. In residential settings, list again only the member. Section 3, Household members. For non-MAGI disability cases, household is not the same as who you live with. Do not list parents or roommates. You would only list other people if you live with a spouse and/or have a minor child you are legally responsible for. If you live in a residential facility, do not list other residents, just yourself. Section 4 covers pregnancy. Answer only for yourself or your spouse if applicable. Section 5, Health insurance changes. Tell Medicaid about lost coverage, like aging off of a parent's plan and the employer doesn't offer disability riders, or losing employer coverage. New coverage, including Medicare after SSDI, and whether a job offers insurance. Include premium amounts and copies of your cards. Why it matters? Medicaid can check Medicare Savings Programs eligibility and, in some cases, may reimburse cost-effective employer plans. But they need documentation, like a benefits summary. Section 6. Disability and work expenses. Even if it isn't new, check yes that you have a disability and include your diagnoses. If working, list work-related expenses like paratransit that can reduce your countable income. Section 7. Parent left the home. For most adult cases, this is not applicable, but answer if it does apply. Section 8. This is extremely important. For adults ages 18 or over, Medicaid reviews the Medicaid member's income only, unless they're married. List earned income, wages, or self-employment, and unearned income, like SSI, SSDI, DAC, etc. Do not list family income, SNAP or food stamps, HEAP or Home Energy Assistance Programs, or self-direction budgets. Those are not countable income for this renewal. If there's no income, be specific about how needs are met. Example, supported by family, savings, etc., to avoid follow-ups. Medicaid may ask for a letter of support explaining how basic needs are met. Include the supporter's name, relationship, contact info, what support is provided, housing, food, utilities, transportation, personal expenses, whether it's ongoing and a signature or date. You'll see an example to the right on the screen. Report any job changes, student vocational status, and premiums or court-ordered support you pay. The MBIWPD program prompt. If working, the Medicaid buy-in for working people with disabilities may help. Be aware, checking the box isn't an application. A full application is required. It can eliminate spend downs and apply special wage deductions. Section 9, Housing Share. Report the Medicaid member's portion of housing costs. For example, if total rent is $1,300 and perhaps Section 8 or HUD pays $1,000 of that $1,300, list your portion, $300. This amount may change year to year. Report the current portion. Section 10, Citizenship or immigration changes. Note any changes since the last renewal. Section 11, Resources or assets. List any assets that can be converted to cash. Bank accounts, stocks, bonds, retirement accounts, cash value life insurance, ABLE accounts, and trusts. Even if an ABLE account or trust balance is excluded, they must be reported. Primary home and one vehicle are excluded. If there's more than one home or vehicle, those you must list. Excess may count. If married, provide spouse's resource information. If not, just write NA for not applicable. Some helpful documentation to include with the packet. For adults with disabilities, especially those in the OPWDD HCBS waiver, add a note that the member is disabled, enrolled in the OPWDD waiver if applicable, and requires full Medicaid including CBLTC, Community-Based Long-Term Care, Code 19. Attach helpful documents like the OPWDD Notice of Decision, the LCED, or an agency letter to ensure the district budgets the case under the correct non-MAGI disability rules, not as income only. The final steps. Again, make sure you sign and date the renewal, as unsigned forms will not be processed. Be sure to mail or deliver the packet by the due date to the address shown. Keep copies. Watch your mail for either approval or a request for more information, and respond quickly to avoid gaps. This process moves faster when everything is complete and clear the first time. If you receive a deferral or request for more information, respond before the deadline with exactly what is requested. Thank you so much for watching. If you have any questions or need follow-up support, please reach out to your care coordination organization or care manager for further assistance. Thank you so much, and enjoy your day.